This is so well aligned with the functional medicine model, just like you mentioned. I mean, in our foundational teaching, we try to convey this concept that oftentimes there's a single kind of underlying factor that manifests in different ways in different people based on all these kinds of variables. And that's so well aligned with what you just said.
Yeah.
So my clinician brain, it has to wonder, I mean, as I look for the type of patient that would benefit from some kind of support in this area, it's hard for me to think of anyone who doesn't need help with their vagus nerve. How do we identify the people that really have dysfunction?
Well, first of all, I would think about. Let me just say, first of all, I don't know the answer to that question. As unfortunately, I've only been studying this for 30 years, but I would say a few things. Number one, um, take a look at patients who have found to be responsive to vagus nerve stimulation. So anxiety, depression, fibromyalgia, um, migraines, cluster headache, and take a look at patients who have multiple disorders that all track back to the vagus. That complicated patient actually does pretty well with vagus nerve stimulation. Second thing I would say is it's extraordinarily safe today to offer patients vagus nerve stimulation. Um, Even the United States Air Force is using one of the devices that we developed to enhance warrior and airman readiness. They found that a normal person has better cognition, able to learn better, can learn a new language quicker, can learn to land the F-15 jets in their simulators quicker. There is less fatigue. There's less errors with the drone operators. So normal people or super soldiers can become super duper soldiers. So on the one extreme, everybody could benefit from this. On another extreme, just think about the very simplistic, you know, do we want to use drugs for a patient with migraine or do we want to use electricity for a patient with migraine? And I think that the spectrum in between is really quite broad here.
Mm-hmm. Oh, so interesting. Okay, so as we're thinking about the vagus nerve, I've now heard you say vagus insufficiency, right? And we use um, vagal stimulation as a treatment. So I'm wondering, is the issue that we have underactivity of the vagus nerve, or is it that the sympathetic nervous system is so active, or is it a combination of both, maybe?
So the answer is yes.
The answer is yes.
So look,
All of
the first thing I would say is um, in today's world, we are under constant stress, under constant threat from I've got this project due to my spouse is yelling at me to my kids got a C in school. We're always worried. We're always in a state of sympathetic overdrive. We need to actively try to get into parasympathetic or rest, relaxation, recovery. Now, teleologically or historically, I would kind of think of us as hunter gatherers that would be sitting out in the fields gathering, or you'd be occasionally going on a hunt. But most of the time, our ancestors were in a state of parasympathetic overdrive, parasympathetic, tone. Once in a while, you'd have to run away from a saber-toothed tiger or a bear or somebody who's chasing you. But the amount of time in sympathetic versus parasympathetic was just reverse of where it is today. We need to actively work to get us into a parasympathetic state where we are rest, relax, and recovery. And that's metabolically better for our cells. It's metabolically better for mitochondria. It's been shown to improve inflammation, as you've indicated. So there are so many reasons to do this. And however you do this, I think it's important. I've developed a biohack, but cold water immersion, deep breathing, pranayama yoga. There are many different strategies that people have developed over millennia to try to activate the parasympathetic nervous system, to activate the parasympathetics, to spend more time in rest, relaxation, and recovery. And we've seen health benefits just across so many different disorders. With doing this, it's really important to integrate this into a functional medicine paradigm to be part of our thought processes part of our root cause analysis, it's a term that I heard from you guys first, is what's the source of this problem? And sometimes it's okay, I've got a vitamin deficiency or I've got a protein that I need more of. But I think a big portion of our evaluation is going to find that it's an electrical problem. It's a problem with the vagus, and just should be on the um, front of your mind when you're seeing patients. Could this be an electrical problem, or is this just another chemical problem?
Hmm. I I mean, we've mentioned a couple times in this episode that the vagus nerve, part of its function is to help us recover from these stressors. Like you said, you run from the saber-toothed tiger, but then you kind of go back to your baseline state. When I'm talking to patients, sometimes I'll say, if you have to slam on your brakes in traffic, are you like, whew, that was scary, and then you move on? Or does your heart beat and you're, very anxious for the 40 minutes until it takes you to get home, just to get a sense of what that recovery and resiliency is like? It seems to me that the longer we're exposed to these chronic stressors, we become so much less resilient, and it's harder for us to make that recovery. Is that something that you see in your patients that have vagus dysfunction?
Yeah, I mean, I think so. A part of the original vision of dysfunction was more of a traumatic injury, and that can come with a
Mm.
viral infection, can come more with, automobile accident where there's actually a damage to the vagus that can later be identified. And in some of the work on long COVID, for example, they have these constellation of weird symptoms. It's estimated that 70% of patients with long COVID have had a damage to their vagus during with this viral, infection. So boy, I forgot where I was going with this whole thing here. But so two aspects would be virus and injury, and a third aspect I think is psychological trauma. Um,
Mm.
we definitely know one of the first things I learned as a pain physician was that one of the predictors of the development of chronic pain is early childhood abuse. And a guy, Steve Porges, has come up with what's called the polyvagal theory that suggests that there is a damage to the vagus cell bodies such that the dorsal vagus is kind of takes over. That's the fight or flight, that's the freeze portion of the vagus. And um, I think that this whole model of vagus insufficiency needs to incorporate psychological trauma, physical trauma, viral trauma. Maybe we'll find deficiencies in diet, etc. But I do think that this structure is really important and can serve as a foundation for integration of all these different areas that we kind of are piecemeal out there about, diet. Well, how does diet improve serotonin? Well, it's through the vagus. How, sleep disorders. We know that sleep is so important in healthy lifestyle. Well, that's controlled by the vagus. So there's so many things that come back to the vagus when you actually stop and think about it. Uh, um, that it just should be part of your thought process. And again, I sound like I'm an only Vegas guy, but I'm not. I just think that this is one big important piece of the puzzle. And if you're putting together a jigsaw puzzle, the four corners, two of them might be the Vegas, and then there's so many other areas as well. This should just be foundational in how you think about evaluating a patient.